How to get insurance coverage for Parkinson's Duodopa treatment. If you're exploring advanced options like Duodopa for managing Parkinson's disease, understanding how to secure insurance coverage can seem complicated. But with the right steps, it becomes manageable. Duodopa is a specialized treatment that delivers levodopa and carbidopa directly into the small intestine through a surgically implanted tube. It helps control motor fluctuations in advanced Parkinson's disease by providing continuous medication over many hours each day. Because of its complexity and cost, insurance companies usually requiring thorough documentation and prior approval before covering it. First, it's essential to confirm that you meet the medical criteria for Duodopa. This treatment is typically recommended for patients with advanced Parkinson's who experience significant motor fluctuations, such as at least 3 hours of off time daily despite optimized oral medications. Your neurologist or movement disorder specialist will need to provide detailed medical records showing your diagnosis, how long you've had Parkinson's, and how your symptoms fluctuate. They should document your previous treatments, including medications like dopamine agonists or monoamine oxidase B inhibitors, and explain why these haven't been sufficient. The specialist must also demonstrate that you respond well to levodopa and that your symptoms justify the use of Duodopa over other options. Once your healthcare team has prepared the necessary medical documentation, the next step is obtaining prior authorization from your insurance provider. Because Duodopa involves surgical placement of a feeding tube and the use of a specialized infusion pump, insurers requiring a formal request supported by detailed clinical information. Your doctor will submit this request, often using specific forms or meeting certain criteria set by the insurance company. Working closely with your healthcare team and the specialty pharmacy that supplies Duodopa can streamline this process. It's important to understand what insurance coverage might include. Typically, coverage extends to the medication itself, the surgical procedure to implant the tube, the infusion pump, and ongoing supplies like tubing and batteries. Follow-up care and monitoring are also usually covered. However, coverage levels and out-of-pocket costs can vary widely depending on your insurance plan, so it's wise to clarify what expenses you might be responsible for ahead of time. Because Duodopa is a complex therapy, it is only available through specialized pharmacies. These pharmacies often assist with insurance paperwork and reimbursement issues. The manufacturer, AbbVie, offers patient assistance programs that can help reduce costs through copay support or financial aid for those who qualify. Contacting the manufacturer or your pharmacy early can provide guidance on available programs and help you navigate financial challenges. If your insurance initially denies coverage, don't be discouraged. Your healthcare provider can submit an appeal with additional supporting documents, such as detailed medical records or letters explaining the necessity of Duodopa for your condition. Persistence and clear communication often lead to eventual approval. Finally, maintaining good communication with your healthcare team is crucial. Your neurologist, infusion nurse, pharmacist, and other specialists can help you gather the necessary documentation, understand the process, and answer questions about treatment management. They can also help you learn about potential side effects and device care. In summary, securing insurance coverage for Duodopa involves demonstrating that your Parkinson's disease is advanced and not controlled by other treatments, providing comprehensive medical documentation, obtaining prior authorization, and working with specialty pharmacies and manufacturer assistance programs. Because this treatment involves surgery and a medical device, proactive planning and collaboration with your healthcare team are key. Always consult your healthcare provider and insurance company early to understand your specific coverage options and available financial support. Remember, each person's situation is unique, and personalized medical advice is essential for the best outcome.